Assalamu alaikum and welcome to Pediatric Case Review. In this episode, we will dive into the different types of diabetes among pediatric patients. Let's begin. Case number 1. A 13-year-old boy presents with increased thirst, frequent urination, and unexpected weight loss. He has been more tired and irritable than usual. A blood test shows elevated blood glucose and the presence of islet cell antibodies. Question number 1. What is the most likely diagnosis for this boy? A. Type 1 diabetes mellitus. B. Cystic fibrosis-related diabetes. C. Monogenic diabetes. D. Endocrine disorder-induced diabetes. The correct answer is A. The combination of classic symptoms, polyuria, polydipsia, weight loss, alongside elevated blood glucose and positive islet cell antibodies, are indicative of type 1 diabetes mellitus. This form of diabetes is autoimmune and most commonly presents in children and adolescents. Question number 2. What is the role of islet cell antibodies in this condition? A. Indicate insulin resistance. B. Reflect beta cell autoimmunity. C. Suggest pancreatic insufficiency. D. Are irrelative to the diagnosis. The correct answer is B. The presence of islet cell antibodies is a key indicator of an autoimmune process targeting the pancreatic beta cells, which is the underlying cause of type 1 diabetes mellitus. Question number 3. What is the cornerstone of treatment in this condition? A. Oral hypoglycemics. B. Insulin therapy. C. Corticosteroid therapy. D. Lifestyle modification. Unfortunately, the correct answer is B. Insulin therapy is essential in managing type 1 diabetes due to the autoimmune destruction of insulin-producing beta cells. It helps regulate blood glucose levels and is a critical component of the treatment. Case number 2. A 17-year-old girl which is overweight with a body mass index of 28 kg per meter square complains of tiredness and the frequency of urination. Examination revealed acanthosis nigricans. She also has a family history of type 2 diabetes, and laboratory tests reveal fasting blood glucose of 200 mg per deciliter and an hemoglobin A1C of 7.5%. Question number 1. What is the most likely diagnosis? A. Type 1 diabetes. B. Type 2 diabetes. C. Drug-induced diabetes. D. Endocrine disorder-induced diabetes. The correct answer is B. The patient's symptoms, along with her being overweight, also acanthosis nigricans, and having a family history of type 2 diabetes, and lab findings suggest type 2 diabetes mellitus. This type is often associated with obesity and can present with symptoms like fatigue and blurred vision. Question number 2. What is a major risk factor in this case? A. Autoimmune destruction. B. Genetic mutation. C. Obesity and sedentary life. D. Pancreatic insufficiency. The correct answer is C. Obesity, especially in combination with a sedentary lifestyle, is a significant risk factor for type 2 diabetes. It can lead to insulin resistance, which is a key factor of this disease. Question number 3. Which lifestyle change is most beneficial in managing this condition? A. Increasing protein intake. B. Regular physical activity. C. Eliminating all sugars. D. High-fat diet. Correct answer is B. Regular physical activity is crucial in managing type 2 diabetes mellitus. It helps improving insulin sensitivity, aids in weight management, and can positively impact blood glucose levels. Case number 3. A 16-year-old male with normal body mass index experiences mild, stable fasting hyperglycemia since early adolescence. Genetic testing reveals a mutation in the HNF1A gene. Question number 1. This genetic mutation in HNF1A suggests which type of diabetes? A. Type 1. B. Cystic fibrosis-related diabetes. C. Monogenic diabetes or MODY. D. Type 2 diabetes. The correct answer is C. Monogenic diabetes. A mutation in the HNF1A gene is a known cause of a specific type of monogenic diabetes, known as maturity onset diabetes of the young, or MODY, particularly MODY type 3. MODY is characterized by genetic mutations affecting insulin production and is different from both type 1 and type 2. Question number 2. What is characteristic feature of MODY? A. Insulin resistance. B. Autoimmune beta cell destruction. C. Early onset hyperglycemia. D. Obesity-related insulin impairment. The correct answer is C. MODY is characterized by early onset hyperglycemia, typically during adolescence. There is no genetic mutations or involvement of autoimmune process. Question number 3. What is the preferred treatment for HNF1A MODY? A. Insulin injections. B. Oral sulfonylurea. C. Lifestyle modifications. D. Pancreatic enzyme replacement. The correct answer is B. For many patients with HNF1A MODY, oral sulfonylureas are effective in managing blood glucose levels. These medications stimulate the pancreas to produce more insulin and are often preferred over insulin injections in this specific type of diabetes. Case number 4. A 14-year-old boy with cystic fibrosis presents with increased hunger and weight loss despite a good appetite. He has a history of pancreatic insufficiency and requires enzyme replacement therapy. His recent glucose tolerance test shows impaired glucose tolerance. Question number 1. What type of diabetes is most likely in this patient? A. Type 1. B. Type 2. C. Cystic fibrosis-related diabetes. D. Latent autoimmune diabetes in YAS or LADI. The correct answer is C. Cystic fibrosis-related diabetes is common complication. It occurs due to the scarring and dysfunction of the pancreas, which is common in cystic fibrosis, leading to impaired insulin production. Question number 2. What is the key factor contributing to cystic fibrosis-related diabetes in cystic fibrosis patients? A. Insulin resistance due to obesity. B. Autoimmune destruction of beta cells. C. Pancreatic damage and insulin deficiency. D. Genetic mutation affecting glucose metabolism. The correct answer is C. In cystic fibrosis, the thick mucus associated with the disease can damage the pancreas, leading to deficiency in insulin production. This pancreatic damage is a key factor contributing to development of cystic fibrosis-related diabetes. Question number 3. What is an important aspect of managing cystic fibrosis-related diabetes? A. High-intensity exercise regimen. B. Insulin therapy. C. Oral hypoglycemic agent. D. High carbohydrate diet. The correct answer is B. Insulin therapy is often necessary in managing cystic fibrosis-related diabetes due to the insulin deficiency caused by pancreatic damage. It helps regulate blood glucose levels and is crucial for overall management of cystic fibrosis patients with diabetes. Case number 5. A 15-year-old girl presents with symptoms of excessive thirst, frequent urination, and recent weight gain. She also complains of headaches and has noticed a change in her shoe size. Lab tests show elevated levels of growth hormone and IGF-1 or insulin-like growth factor 1. Question number 1. What endocrine disorder is indicated by these symptoms and lab findings? A. Cushing syndrome. B. Acromegaly. C. Hyperthyroidism. D. Addison's disease. The correct answer is B. Acromegaly. The symptoms of increased thirst, frequent urination, weight gain, headaches, and increased shoe size, along with elevated levels of growth hormone and IGF-1, suggests acromegaly. This condition is caused by excessive production of growth hormone, often due to pituitary adenoma. Question number 2. How can acromegaly lead to diabetes? A. By causing insulin resistance. B. Through destruction of pancreatic beta cell. C. By decreasing insulin sensitivity. D. Via increased glucagon production. The correct answer is A. Acromegaly can lead to diabetes primarily through causing insulin resistance. The excessive growth hormone interferes with the action of insulin, making it difficult for a body to use glucose efficiently. Question number 3. What is a common treatment for acromegaly? A. Insulin therapy. B. Surgical removal of pituitary adenoma. C. Corticosteroid replacement. D. Thyroid hormone supplementation. Of course, the correct answer is B. Surgical removal of pituitary adenoma to reduce the levels of growth hormone and alleviate symptoms. Case number 6. A 16-year-old boy undergoing treatment for severe autoimmune disease with high-dose corticosteroids presents with elevated fasting blood glucose levels and symptoms of hyperglycemia. Question number 1. What type of diabetes is most likely in this patient? A. Type 1. B. Steroid-induced diabetes. C. Type 2. D. Monogenic diabetes. The correct answer is B. The use of high-dose corticosteroids is known to cause hyperglycemia and can lead to steroid-induced diabetes. This type of diabetes is a form of drug-induced diabetes resulting from the glucocorticoids' effect on increasing blood glucose levels. Question number 2. How do corticosteroids lead to hyperglycemia? A. By stimulating insulin production. B. Through increasing insulin resistance. C. By damaging pancreatic beta cells. D. By decreasing glucagon secretion. The correct answer is B. Corticosteroids can lead to hyperglycemia primarily by increasing insulin resistance. They also stimulate gluconeogenesis in the liver, contributing to elevated blood glucose levels. Question number 3. What is the key management strategy for steroid-induced diabetes? A. Discontinue steroid therapy immediately. B. Start a ketogenic diet. C. Blood glucose monitoring and potential insulin therapy. D. High-intensity physical training. The correct answer is C. Managing steroid-induced diabetes involves careful blood glucose monitoring and, if necessary, the use of insulin therapy to control blood sugar levels. Adjusting steroid dosages may also be considered, but this must be balanced with the treatment of underlying autoimmune disease. In conclusion, we have different types of diabetes that can affect pediatric patients. Type 1 through autoimmune process. Type 2, especially in obese with a family history and acanthosis nigricans. Monogenic diabetes or maturity onset diabetes of the young. Number 4, diseases of the exocrine pancreas like cystic fibrosis. Number 5, endocrinopathies like Cushing syndrome. Number 6, drug-induced diabetes as with steroid therapy. Thank you for joining us. Stay tuned for more pediatric case reviews.